Hello everyone and welcome to another educational video for the Iran Cranio. I'm Marije van Dalen and I'm a PhD student and psychologist at the Erasmus MC Sophia Children's Hospital. In this video I will be giving you some tips and tricks about how you can best support your child with a visible difference. As a parent of a child with a visible difference, you might have several worries. For instance, what do I tell teachers about this condition? Will my child be teased or bullied? And how do I best talk to my child about their condition? In this video, I will be talking to you about all of these topics. As a parent, you might struggle with the question, how do I talk to my child about their condition? Especially when a child is still young, the child might not be able to grasp all of the information about his or her condition, and medical procedures might be especially frightening. When talking to your child about his or her condition, there are several things to keep in mind. First, adapt the story to a child's age. And not every child might be able to grasp all of the details, so adapt it to their child's age. Young children are often not able to grasp the entire story. Their world is still filled with fantasy and play. So for children up to 6 years old, you can use a doctor's kit to play out what has happened to the child or what will happen to the child when he or she goes to the hospital. Play out the story together and your child might be able to grab some of the information and might be less frightened for the next hospital visit. For older children, you can just tell them the story, but you might want to leave out some difficult facts and details. Be sure not to flood the child with difficult language. So for instance, you could say to a child, "You were born with a lip that was not fully grown. This did not hurt you, but the doctors did have to fix it for you. And that's why you now have a scar. And that is also the reason why the doctors want to see you now, because you've grown older, you've grown taller, and the doctors want to see if you're doing well." Another thing to keep in mind is that you need to stick to the facts. Use neutral language to describe the child's condition and avoid getting nicknames for the child's condition. By doing this, you will avoid passing judgment to the child. And another advantage of sticking to the facts is that your child will know what language to use when talking about his or her condition. So use neutral words to talk about your child's medical condition. So for instance, when a child is due for surgery, instead of saying, "Oh, the doctor is going to do surgery on you to make your face look more normal," you can say the doctor is going to do surgery on you to make your left and your right mandibular the same length, and that way it becomes easier for you to chew your food. Another thing to keep in mind is don't beat around the bush. Don't avoid talking about the child's condition, because this way the child might grow up and learn that his condition is something that should not be talked about, even though the child might have some questions about his or her condition. If you are not sure when to raise the topic, prior to a hospital visit will be a good occasion. You can talk to your child and say, "Okay, we're going to the hospital because you've grown bigger, you've grown taller, and the doctors want to see how you are doing and how you are developing." Older children, especially when they're going into puberty, might not want to talk about their condition. They might feel as though they're being lectured and they will probably try to relieve this situation. For instance, they might go upstairs to their room. If you do want to talk to your child about their condition, it's a good idea to do this while you're doing an activity together. And that way it does not become the sole focus of the conversation. So for instance, you can try talking to your child when you're making a cake together, doing the washing up, or when you're sitting in a car. And this way the situation will become lighter and the child might want to talk to you about their condition. And last but not least, a very important thing to keep in mind is that always emphasize to your child what they're good at. A parent isn't who they are much more. So give compliments to your child for being very sporty, doing very good at school, or having lots of friends. Because these are all very important things for your child to learn, that the appearance is only a small part of who they essentially are. Your child might encounter difficult social situations in which people might stare or comment on their condition. These situations might also affect you as a parent. Keep in mind that people are usually curious and just want to know what it is. If you want to know more about the techniques about how you can deal with difficult social situations such as unwanted comments and questions, you can always watch the other video for the Iran Cranio here. I will insert the link below. When you're in a social situation and someone asks about the condition, there are two ways in which you can handle the situation. When the child is still young, you might want to react for the child. If you respond in a calm and confident manner, your child will know how to react in the situations because he can look at you as an example. And how you respond will probably differ per situation. You might not want to explain everything to everyone. If you don't feel like talking about the condition, you can just say, "Oh, he was born with it, but I prefer not to talk about it now." For young children, you can also help them by talking about people or situations in a way that avoids judgment about appearance. For instance, you can talk to them and say, "Oh, you know, this teacher is very strict." Or you can say, "This girl in your class, she's really nice." And that way children will learn to look at things other than appearance. When your child grows older, he might be able to react to these situations yourself. And you can help the child by making a sort of list and thinking about how you can tackle each situation. For instance, your child might want to reassure other children that ask about their condition. The child could say, "Oh, I was born with this, but it doesn't hurt me now." You can also help your child by talking about difficult social situations that have come up and how we could respond to it the next time. Talk about these situations together and think about a way that your child could respond to the situation the next time. This way, your child will grow more confident that he can handle these situations in the future. You can also help your child by reflecting on social situations together. Tell your child that people are usually curious and just want to know what the condition is. You can also help your child by labeling situations in a positive way. So for instance, when someone is staring at the child might think, "Oh, they're looking at my visible difference or they're looking at my appearance." Well, in reality, they might just be looking at a very nice hairdo or a very nice outfit that your child is wearing. So help your child by labeling situations in a more positive way. As your child grows older and starts going to school, you might have some concerns about how you can best inform the teacher and the class. Prior to starting school, you can inform the teacher about the condition and the effects that it has on your child. Be sure to use language that you also use so that the teacher will know what language to use. If your child has any special needs related to the condition, be sure to inform the teacher. Another thing that you can do for other staff and other people in the school is you can make some kind of leaflet with information about the condition that your child has. By informing all the other people and staff, they will be more familiar and they will be less likely to stare or ask questions that you're not prepared for. You can also use this leaflet to give to other parents in the class. This way the parents might inform their children about the condition and the children will also be less likely to stare or ask questions. As your child grows older, it might be a good idea to have your child give a presentation in class. Your child could give a presentation about what his condition is and what his medical trajectory was. Especially if your child misses school days due to hospital visits, it might be a good idea to give a presentation so his classmates will understand why the child is often not in class. Because often unwanted comments and questions are due to people not understanding the condition. And by informing these people, you will probably take away some of their concerns and they might be less likely to make comments and questions towards your child. When your child is very shy, you could also discuss with the teacher if the teacher can inform the class so that at least everyone knows what's going on and that they have some information about your child and his or her condition. Another advantage of giving a presentation in class is that the conversation will be guided by the teacher. This way it will be a safe space. The teacher will guide the conversation and children will be less likely to make rude comments during this presentation. And it also provides a space for other children to ask genuine questions that they are concerned about. Maybe they're concerned that your child is in pain or they might have other concerns. And this will be a good occasion for all these children to ask their questions. Thank you for listening to this video. I hope I've given you some useful tips and tricks about how you can best support your child. If you want to know more about this topic, be sure to visit our YouTube channel, subscribe to it because more videos will be coming soon. Bye!